So it's my very great delight this afternoon to introduce you to Dr. Clare Spencer, who's a GP, and she just told me that she's just come off a 2-hour sort of, and it sounds like some kind of seminar to 200 trainee GPs, where she's given them 2 barrels about the menopause. So there you go. It's good to hear that GPs are actually being trained in the subject very specifically by somebody who's as passionate about the subject as Claire is, because she's a real specialist when it comes to the subject of the menopause. I just tell you briefly that she contributes to a menopause clinic in Leeds, which is one that you get to via GP referral. She also has a website, which is called My Menopause Centre. Is that right, Claire?
That's right. Yes.
Right,
yes.
the right title. So this is a website anybody can access, literally up and down the country. And this is a private specialist menopause clinic with an absolute wealth of information on it. So a really good place to go and have a look for information. So my first question to you, Claire, is fairly simple. As a GP, why did you ultimately decide to specialise in the subject of the menopause and get involved in the way that you now have?
Yes, thank you, and good afternoon, everybody. It's really lovely to be here. So I actually started out in obstetrics and gynecology, in gynecology. So I've always had an interest in women's health. Switched to GP for better work-life balance, keeping that interest. But as I gained years, I think I really saw that there was a massive gap in knowledge, and so women weren't appreciating the scope of symptoms that you can experience going through the menopause. So really saddened me to hear women think that they weren't coping, or they thought they might be struggling with depression or anxiety, because they didn't recognize that those symptoms were as a direct result of the menopause, and therefore there were different management options that could be more effective to them. And I could also see, actually, from my primary care colleagues, that there was a bit of a lack of understanding amongst GPs as well, and a bit of a knowledge gap. And so that's why we set up My Menopause Centre, where there is a private clinic, but there is actually a huge amount of free information for everybody, of evidence-based, correct information for everybody to access. And we wrote a questionnaire that allows women to try and work out if they are in the menopause transition as well. So it really came from seeing the gap on both sides that I decided to specialise.
Yeah, it's a big subject, I should imagine.
Big subject, yes, yes.
Start looking at it. And so tell us a little bit, just to clarify, the sort of classic, but perhaps well-known but less well-known menopause symptoms. So what do women experience when they start to go into the menopause and then a full-blown menopause?
Yes, yeah. So there is a massive range of symptoms that really reflects the fact that estrogen, the hormone estrogen, which is the predominant hormone our ovaries make, is really essential for so many different parts of our body to function optimally, is probably the best way to describe it, including our brains. So there are physical symptoms that many women will have heard of. So in that I include hot flushes. Night sweats will be experienced by 80% of women. But other physical symptoms like aches and pains, worsening aches and pains, new aches and pains, bladder changes, so that feeling like you need to run to the loo, feeling a bit like you've got cystitis but without having an infection. Dry mouth, dry skin, dry eyes, dry vagina, and funny skin sensations can go with loss of estrogen. Migraine, headaches become more common in the menopause. So you've got all of those physical symptoms. Then there are psychological symptoms. So anxiety and worsening anxiety. So depression, from mild to worsening clinical depression, and sadly women saying that they're experiencing suicidal thoughts even, and lack of enjoyment in life. And then cognitive symptoms, so brain fog, poor concentration, memory issues, word finding difficulties. So all of these really affecting function. And then low libido. I mean, it's so common. It's common as you increase in years for men and women, but particularly for women with the loss of hormones transitioning through the menopause. So very long answer to your question, but really broad range. I think we listed and wrote about 38 symptoms on our website.
Yeah, that's really interesting. And some of the things that you mentioned there, like aches and pains and brain fog and stuff, it's very easy to put those down to something else if you don't know, I would assume,
Yeah.
because aches and pains, you could say, well, I'm getting older, so it's inevitable that I've got the odd ache and pain, you know what I mean? And also this, the sort of mental, the feeling that you can't concentrate and all that sort of stuff, the brain fog thing. Again, you could put that down to just getting older. Oh gosh, this must be because I'm getting older. So it's quite interesting that presumably once you pin them to the idea that you are either perimenopause or you're actually, in the menopause, helps with treatment. Now, we had a really good conversation this morning, and it's something I just want to explore with you now, about HRT. Because when I was going through the menopause, which was a long time ago, it's my late 40s, it's the end of the 1990s, HRT had an unbelievably bad press, seriously bad press. So I'd like to explore with you why that was, what caused that, and then if you'd like to give us, in as much detail as you wish, a kind of evolution from the early days of HRT through to the experience that I had. I was telling you this morning, it was quite funny. I was talking to some friends and told them that because I had violent migraines, I'd been put onto HRT, and it was literally as though I said I was mainlining heroin. They were horrified. They looked at me and went, "You're what?" It's like, yeah, I'm using HRT. You must be mad, So let's tell the story, because I think it's a very different picture now, and it's an important one to talk about.
No, absolutely, because it's opened the doors to so many women getting help that they didn't have before. So the anxiety really started with the publication of 2 or 3 big studies, the Million Women study, and then the Women's Health Initiative study. And the Women's Health Initiative study was published in the early 2000s, and that was a massive randomized control trial. So that's seen as like gold standard in study design. And they stopped it early because there was an indication that HRT increased the risk of breast cancer. And so literally when that hit the headlines, and it really did hit the headlines with sensationalized statistics, GPs stopped prescribing HRT, women stopped taking HRT. And that's really when you can see the level plummeted. It was really from the publication of that study. And it never really recovered. Well, it didn't recover for many, many years. And I think it's only really in the last probably 5 to 10 years that the subsequent analysis of that data showed the risk of breast cancer with that older style HRT, older synthetic hormones, was lower than other lifestyle factors. So, for example, they reanalyzed it according to age, and they found out that women in their 50s had a higher risk of breast cancer if they drank on average 2 units of alcohol a night, so 14 units a week, or if their body mass index was 30 or higher, than taking that older style HRT. So that thought started to permeate through, and people started to dip their toes in the water, and then something else happened. In around 2008, there was a publication of a big French observational study that showed if you take bio or body identical hormones, so these are hormones that are the same biochemically as our own hormones, the risk of breast cancer was even lower than first thought. So old study, old hormones, high risk of breast cancer, synthetic, new analysis, and then newer hormones being introduced that we can, bog standard doctors can prescribe. And the table really did then start to turn. And I do think that, so first Mariella Frostrop, And then Davina, you know, women speaking out. Kirsty Walk spoke out about their own menopause experience, just sort of helped break down a few of those barriers as well, with more education for GPs and doctors. I think we're still not back with HRT uptake to where we were in the 90s, maybe when you started HRT, but we're certainly on our way back there, which is why there's been huge issues with supply, because brilliant, everybody's asking for HRT, but the supply couldn't keep up with the demand. So yeah.
I find all of that really fascinating, and how something like that study can be misread and then impact on literally millions of women, because for me HRT saved my life. I mean, it puts quite a high stress on that, but it was true. As soon as I regulated my hormones and the migraines more or less stopped, I could get back to the life that I'd had before, which was destroyed by the whole imbalances that I was feeling. Actually, I'll just pick up on something you just said there, about the taboo elements to menopause. And isn't it interesting that it is relatively recent that we have been comfortable to have it in the public arena from the point of view of discussing it and so on. So I think the menopause has been one of those terrible, almost dirty little secrets that women, especially women at work, have just had to keep stum about. So what are your thoughts about that? What do you see in the taboo aspect of it?
It's really interesting. So this is only my view, and my view is slightly warped because I talk to menopausal women all day, every day. I think within society, I think it's far less of a taboo. I think women in their 40s and early 50s are now talking about it more. And happily, please contradict me, but I think going out, women and their friends, they're more likely to chat about it. I think in the workplace, though, there's still so much work to be done. You know, I think women still feel that it's a bit of another stick for somebody to beat them with. You know, you've survived the whole maternity leave bit, you've worked and worked and worked. So at My Menopause Centre are increasingly though going directly into the workplace, and so we're running workshops in companies of all shapes and sizes. I've led workshops on the factory floor, for example, for women who are working shifts, lugging sofas around, you know, all the way up to the boardroom. And the issues are the same, whether you're pushing sofas across a factory floor, to trying to keep your marbles in a board meeting. You know, it's all, can I concentrate? Can I remember what I'm meant to be doing? I'm feeling anxious, I'm having a hot flush. But with more conversation in the workplace and education of particularly male managers, unfortunately, although some female as well, sadly, I think it's starting to so women are becoming more comfortable talking about their symptoms, but we are not there yet by any stretch of the imagination.
Yeah, I find it incredible in this day and age that we can still have those issues around something that's natural, occurring throughout half the population.
I know.
And yet, you know, it has all this stuff around it because it's a woman's thing, and you know, as you say, it's another stick to beat women with if they choose to use it. Hopefully there are some enlightened men out there who would never dream of doing that. So I think that's it's hopeful. You know, hopefully for the younger generation coming up, it will be better for them. What I'd like to do is I'm very interested. You talked about the various things that you have on your website, and I'd like to go through them one by one, really, because it occurred to me after I'd spoken to you this morning that each of these is relevant for the rest of your life, really. This isn't a menopause thing. So anybody on here, regardless of where you are in relationship to menopause. So the first advice that you give on there, or guidance, is to do with nutrition. So let's talk about nutrition. What are the key things, do you think, there from the point of optimal managing the menopause nutritionally?
Yes, no, completely. And so I think before I fully answer, there are two parts to this. So we've got managing symptoms of the menopause, which we know for some women will linger well into their 60s and 70s. And then we've got managing the long-term health consequences of the menopause. So for women going forward in life, managing the increased risk of osteoporosis and heart disease particularly. So I think those two factors need to keep bearing in mind when we sort of talk about particularly nutrition. So nutrition to help manage symptoms is all about avoiding sugar swings, avoiding alcohol because it's vasodilatory, avoiding spicy food, avoiding caffeine, hot sweat and hot drinks, because that can make a hot sweat come on. Nutrition to try and minimize your risk of osteoporosis and minimize your risk of heart disease, then the evidence lies around Mediterranean style diets, making sure that you're getting enough vitamin D and calcium in your diet. So that's where the best evidence lies. You know, we have nutritionists on our website and they would talk more about the intricacies, but they're the sort of two broad areas. And then obviously weight loss. So weight gain in the menopause is such a common depressing issue for many women. And it's not just the menopause, sadly, it's as you increase years, you're more prone to put weight on around the middle. And that is, a lot of that is to do with how your body changes, how it handles carbohydrates as you increase in years. And so it's a really poorly studied area, but it sort of makes sense that sort of minimizing but don't stop carbs, minimizing carbs, increasing protein, and really watching your calories, watching how much you eat is a really important part of that whole story as well. So does that make sense? Different facets to it. Yeah.
Completely makes sense. And as you say, the whole issue around getting enough protein, osteoporosis and all that kind of thing. Really important. The next thing I want to talk to you about is you have something like about this on your website, supplements. So I've got a bit of a thing about supplements because I think you produce quite expensive whey by taking extra things like that.
Yes.
Some people swear by them, and in fact there was a thread on Super Troopers recently about collagen supplements. So you know, it feels very tempting, doesn't it? Oh, my skin is lacking in collagen, I'll just take a pill and that will increase it. So what are your thoughts about supplements?
Yeah, so the issue with many supplements is they're broken down in the stomach, and so we don't really know whether they stay active after you've swallowed them. And a lot of supplements that are recommended, there's very little evidence behind them. So from a sort of a standard conventional doctor's point of view, the main supplement, the most useful supplement is actually vitamin D, which everybody should take during the winter months, regardless of age, but particularly as you do lose estrogen, as you gain years. So taking, in England, we would say about 400 to 800 international units from, I think they said from September, October time through to March is really sensible. There's bits and bobs of evidence that some of the B vitamins can have some effect on mood. Women tell me that magnesium helps them to sleep, but then as many women will tell me that it hasn't made any difference. You know, it's a bit of an unevidence-based minefield, but the main ones are sort of vitamin D. And then, you know, you can choose if you want to take other things, then fine, take them. They're unlikely to do any harm, as long as they are unlikely to do any harm.
Yeah,
that's my slightly boring take on it.
No, I think that's helpful because, you know, you are a qualified doctor, you know, you're not a snake oil salesperson. And I think vitamin D, great recommendation. I certainly take vitamin D. I do believe in vitamin D. It's the other stuff that bothers me a lot because some of it's very expensive, and possibly some of it has a placebo effect. I'm also very interested in placebo, so it could be that you're taking a very expensive supplement, you think, oh, it's definitely making me better.
Yes, no, completely. And so I think I read a statistic that most menopause therapies have around a 50% placebo effect. Now, don't knock it, but yes. No. And I should have said also, oil of evening primrose actually does have some evidence that it can help breast tenderness. So if you're really struggling with breast tenderness, the dose is on our website, mymenopausecentre.com, but oil of evening primrose can be helpful for that. It is the only thing it's helpful for, I have to say, not hot flushes. Yeah.
Okay. All right. Thank you. So we've looked at supplements. The next one is exercise. So tell us about that.
Oh, yeah, exercise completely. But I think exercise can really make massive difference. And I speak to so many women who aren't moving for whatever reason, and it can be really challenging if you have loss of motivation, if you feel rubbish, if you've got osteoarthritis, if you don't, it can be challenging. But if you can find a way to move that suits you, it can increase relaxation, it can help your mood, your sense of well-being, your confidence, reduce your risk of osteoporosis, because particularly if you're fast walking, you don't have to start running or run a marathon. Fast walking can be really helpful across the board for weight loss. Sorry, you can tell I am a really strong advocate for moving in some way. Yoga is very low impact, but is a brilliant way of switching your brain off, but using your own body weight to maintain and build muscle mass and stretch. So yes, really positive. Yeah.
You started running marathons relatively recently, is that right? Tell us about tell us what you told me this morning, because it's a lovely story.
Oh yeah, no, so I'm 50, and so when I was 48 I decided to run my first marathon, never having run in a race before. And literally I just downloaded a training program and just did it, plugged into my audiobook, left the children, husband, dogs at home, and just went. And yes, so obviously within reason, but I just found it, my life is very busy, and just having that time, it's almost meditative when you're just out running. I'm lucky I live in Yorkshire, got lots of space outside, and yeah, it was great. And I raised lots of money for charity as well, which obviously helped.
Yeah, good for you. And as some people on this call will know, I didn't start exercising until I was 69. I was a very late comer to exercise. It's never, ever, ever too late. And I can't believe how my body has responded to exercise in the last 5-6 years that I've been doing it. It's absolutely phenomenal, and I'm so glad. And it doesn't matter, I could start it now and it would still have a great effect on me. I happen to, as I said, have been doing it for 6 years, but it's been brilliant. And then the last thing I just want to talk to you about from your website, talking therapies, but specifically around sex and relationships, because again, we talked about that this morning. This is another subject that's not widely talked about, but it's really, really important to mention, I think, the impact of the menopause on your sex life, and and how you handle that, and some of the physical effects of it, which will affect you, the comfort of having sex and so on.
Yes, no, absolutely. It's not difficult to see, isn't it, when I'm listing all these symptoms that can all knock your self-esteem and exactly not make you feel very sexy. But the loss of estrogen on the vagina can cause it to shorten, become drier, lose its stretch and elasticity, and that can mean that sex is just not pleasurable and even can be painful. And that's not one of those things that tends to get better with time. It does need intervention. But the great news is, number one, although it's really common and it's poorly spoken about, if you do mention it to your GP or doctor or nurse, then using a vaginal estrogen can really sort it out. So vaginal estrogens you can start at any time, at any age. There's no risk of breast cancer, heart disease, strokes, blood clots, any of the sort of worries that people have with regards to systemic HRT. And it can make all the difference, because the saddest thing that I'll hear in clinic is, well, sex was really painful 7 years ago, and so we haven't done it since. And I really mourn the effect on my relationship, where it is a treatable issue. I think the other big issue is loss of libido, so loss of sex drive, and that is really complicated and not an easy nut to crack. hence the sex and relationship therapists who we love to work with, because they can really explore why, what's going on. Women's desire to have sex does naturally decrease with age, and so does men's, I have to say. But although the desire can go, the enjoyment can still be maintained. So the sex therapist would really talk about keeping the lines of communication open, just going back to the drawing board a little bit and reinventing, just making sure you are still having a degree of physical intimacy, because then you get a positive feedback in your brain, and lo and behold, actually you might feel like having sex where you weren't before. Really important to keep the communication lines open. So it's a big old complex subject, but really important to address.
Yeah, really important to address, because as I said, I think it's probably not, well, I could be wrong, but it's not widely talked about, or perhaps some people find it very, very difficult to seek help around that. But it's interesting that you offer it. And then the other talking therapies that you have, would that be about other things? Or
yes, yeah. So there's really good evidence that cognitive behavioral therapy can help with the physical and psychological symptoms of the menopause. So cognitive behavioral therapy is one of those talking therapies where it helps to challenge your thoughts and belief and turn that into an action, is my very simplistic view of it. And so, for example, some women have hot flushes, and the hot flushes will get worse because they're anxious and fear the hot flushes. And so CBT would help challenge that vicious cycle that's feeding into those physical symptoms, feeding into the hot flushes, taking away some of the anxiety. I mean, HRT is brilliant, but sometimes it doesn't help every aspect. Sometimes life is difficult, isn't it? And HRT doesn't make it not difficult. Whereas, some talking therapies can help you explore what's going on and come up with other strategies and adaptations, really to move forward positively, as we spoke about earlier today, just really trying to move positively into your 50s, 60s, 70s and beyond.
Yeah, I think, I mean, menopause could be just one factor, couldn't it, in a series of things that you're having to confront or face at that particular moment in your life. It could be complicating factor for other things. But I would quite like to finish on a positive note, because as a 74-year-old woman, I have to say that my postmenopausal life has just been fantastic. Every minute of it. And I love the freedom from periods, from the menstrual cycle, which is a pain in the backside a lot of the time. I'm the freedom from obviously having to worry about contraception and stuff like that. Being infertile, I see as a positive thing, not a negative thing. And I think for me, and for a lot of women that I know, once you get through it and you really do emerge at the other end, it releases a huge amount of energy and enthusiasm for life and excitement about what's possible. So I think menopause has been hidden, it's been taboo, it's been one of those things that is seen as a bit of a nightmare, and it can be for some women. They sail through it, but out through the other end, I think you can have a real new lease of life. And I wish that aspect of it was more widely known and widely acknowledged, because it means that younger people dread aging much less if they think that there's an aspect of renewal that you can go through afterwards. So as I said, from somebody, I started my menopause in my late 40s and went through it with HRT, came out the other end, and I love my life now, and I'm probably happier than I've ever been. And so that's the big message, I think, Claire, don't you? It's a very important message.
It absolutely, I give a lot of talks and I talk about it feels like doom and gloom, we talk about all of those symptoms, and I think you're absolutely right. All those symptoms do exist. Help exists to help you through those symptoms so you can emerge the other side of it. with the whole of the rest of your life ahead of you. Absolutely. Yes. Yeah.
Good. Thank you very much indeed. That was absolutely brilliant. Okay, so we've got Esme. How nice to see you.
Everybody's on mute at the moment. If I just ask you to unmute, then it should pop up on your screen.
We've only got two. We've got Sharon and Esme left. So
interested people, because I had my menopause 26 years ago, and I'm still taking HRT and intend to take it for the rest of my life. I had a hysterectomy, so I'm on unopposed estrogen, which I guess makes it a little bit safer, but I've looked at the risk benefit, and for me, the benefits so outweigh the risks. So that's mine. But I now have a daughter-in-law and a daughter who are going through their menopause or their perimenopause, although my daughter had cancer earlier this year, so she's also had a hysterectomy now. But you know, it's really looking at how best, with you know what's happened since I had my menopause, how best to talk to them about theirs, and you know what has changed, as you say, since we went through our menopause.
yes, I think that's a really good point. It's something that I talked to you about this morning, Claire. I've got two daughters, one's 48 in November and the other one will be 44, 45. So they're going to be approaching menopause, where the older one is very, very shortly. And I'm hoping it's going to be a very different experience for my older daughter. So Claire, what are your thoughts about that?
I think yes, I think that for that generation, it will be different, you know, because when we're going into companies, you could have 200 people on a call and there'll be a whole range of ages. So it was fascinating talking to you this morning, actually, Tricia, because I hadn't thought about what it must have been like going through it when there was all the negative publicity. So I've got a 13-year-old daughter, and I was giving a talk on a Saturday in person in Leeds. I said, "Oh, Fenella, would you like to come with me?" And she said, "Oh, is it about the menopause? Oh, not again." You know, she's like that. Then those teens will be completely like, they don't seem to be fazed by anything. So you know, for your daughters it will be easier, for the notch down it will be easier still, and hopefully by the time my 13-year-old is 40 it will be just, you might be able to buy HRT over the counter, you never know.
Well, they're talking about it now, aren't they?
Yeah, so I don't know if you've seen that. So you can now buy vaginal estrogens over the counter. That's what you can buy. You can buy Vagifem equivalent. It's called Gina, for the vaginal symptoms and bladder symptoms. So yeah, it is available.
Yeah, which lessens the taboo and everything, doesn't it? As soon as you make that kind of thing commonly available, you've not got that barrier of having to go and talk to the GP and stuff. Sharon, your thoughts?
Hello, Tricia. Can you hear me? Okay.
Sharon, nice to see you.
And you too. I was interested to hear what Esme had to say, because I too had a hysterectomy in the early 2000s. And I did ask them to take my ovaries at the same time, because my grandmother had ovarian cancer, and I just wanted to remove that sort of uncertainty about things. I mean, I was told that the ovaries would stop working within 2 years anyway of having the rest of it taken away. So that removed that worry for me. I was put on HRT straight away, but estrogen only, because obviously not the combined. And then there was all this hoo-ha about breast cancer. And so I was living abroad at the time, and the doctor I was under there said, "Oh, we must wean you off HRT, blah, blah, blah." Anyway, I was weaned off it. But my question now is, I haven't been taking it for a number of years. Is there any benefit to me in restarting it? Now, this is in terms of preventing any problems in the future rather than treating symptoms I've got. Yes, the vaginal dryness can be treated, as we've just said, with this Gina, but is there any benefit in having HRT now for me going forward? I'm 68.
Okay, so you're 60, and how many years is it since you stopped your HRT?
Probably about 10 years.
About 10 years. Okay, so if you start HRT within 10 years of the menopause, or we think stopping HRT, you're likely to get a benefit in terms of reducing the risk of heart disease. If you start it after 10 years or over the age of 60, it won't increase your risk, but you don't get the benefit. You will get some benefit in terms of protecting your bones against osteoporosis. And it probably won't affect the risk of dementia one way or another, is where it lies. So the British Menopause Society say they don't advocate use of HRT where there are no symptoms. They say we don't advise this for treatment, for health prevention only. Having said that, it's really interesting because estrogen only HRT, as Esme said, has little or no increased risk of breast cancer over and above your own age-related risk. And it will help protect your bones against osteoporosis. That's a massive issue in aging women. You know, 1 in 3 women will suffer an issue related to osteoporosis. So you have to take everything into account. It's quite a difficult conversation. It's quite hard to say no, although the British Menopause Society say you shouldn't take it for prevention only. It's interesting.
Yeah, thank you.
Yeah, I had an experience because when I had my hysterectomy, I had implants. I had hormone implants, and then it started getting very expensive, and they stopped making them, I think. And so my gynecologist said, oh, just let it run out, and see what happens. And because the implant sort of stays in your system for quite a long time, I had to have them every 6 months. I one day woke up and it was like having a complete crash. I cannot describe it. I felt as if the bottom had dropped out of my life. And I went and said to my GP, I need patches. I didn't really fancy patches, but now I don't care. I don't care about anything anymore. And as soon as I went back on it, I felt like me and normal again. So I am definitely on it for life. My GP did say, I think you should come off it. And I said, no, don't want to come off it. It is now part of me. And I also had my ovaries removed. And I think, you do need, because even when you've got ovaries, I understand you have a trace of estrogen.
Yes. Yeah.
Even after the menopause, they are providing a trace. So if you haven't got those, I certainly think, and it's not just for the symptoms, it's for your joie de vivre, it's for everything. My mother died of osteoporosis, so that's a jolly good reason as well.
Yes.
So yeah. I definitely, I'm on it forever, as long as I can get it.
Completely. And if your GP at your annual review says you have to stop it, just say, can you tell me exactly why? Say why. And yeah, no, absolutely. And as long as you accept that there is probably a small increased risk going forward of breast cancer, even though it is estrogen only, they probably won't have an answer.
No. Well, I did say that, well, if you don't give it to me, I'll find someone who will. And one always can, of course, if you're prepared to pay for it. But I'd rather not anyway. She said, okay, you are. I can see that you're very determined. Like a bulldozer.
I support you 100%, Esme, actually. I came off estrogen. I was on patches, but I had a Mirena coil because I have a womb. I haven't had a hysterectomy. And that Mirena coil, I think the effectiveness of that degrades over time. It has less and less effect. So I was a bit worried that I wasn't having the balance of the progesterone in the womb. And I didn't want to have another Mirena coil or have it, removed or whatever. And I just thought, so what I did, I went to my GP and talked to her about it. And she said, oh, just stop it like that, just stop it. And I thought, oh, that doesn't sound like a good idea. And I was on patches. So I cut the patch down. I shaved a tiny bit off over a very, very long period of time. So it's really, really, really weaning myself off it. And then when I was down to a sliver, and which was probably having no effect whatsoever. And I had no effect of it stopping at all. But so it was a very, very positive experience for me. But that's because if I didn't, do you know what, Esme, I'd be like you. If I didn't have a womb, I would definitely stay on it. I would stay on it because I think it benefits your skin. I think it benefits your hair. I just think having that bit of estrogen, which, as you know, Claire, as you've said, has quite a big impact on you and psychologically and emotionally, all that stuff. I would definitely be on it. And you look great, Esme.
All the hormones and the makeup.
Oh, but of course.
When I first started doing HRT, I also had testosterone. So, but that I stopped, and that didn't seem to make very much difference to me.
Yes, and that's true of many, many women. So testosterone is really interesting. So it seems to be really important for some women, but not others. So for some women, it can really help boost their libido or just make that marginal change that makes it all right. But the studies say about 2/3 of women get benefit, but I think there are a lot of women who take it and it doesn't make any difference. So yeah, that's the experience shared with many. Yeah.
Are there any other questions before we wrap up? So you got anything else, Sharon, you want to ask or say? Or
no, thank you. It's been very interesting.
Good. Yes, it's brilliant.
I think it's so important now that it is talked about, and it's actually everywhere. You can hardly escape it in women's magazines, but I think that's wonderful because it once you've opened up the conversation, then people can get help, they can get the support they need. So I think that this is a really great initiative, that there's more about it for everybody to find out.
Yeah, agree 100%. And that's got to be a good thing. And it's quite interesting. It's sort of quite glamorous people like Mariella Frostrup and Davina McCall. It's like,
yes,
because they're glamorous, and we associate them with sort of being young and sexy, I suppose. It's kind of it. That's the point. It's sort of, you can talk about the menopause then. Oh my goodness, even women like that go through the menopause. Well, of course they do. It doesn't make it any less attractive, does it? Lovely. So thank you very much indeed, Claire. That was brilliant. And yes, I think I'll wrap this up and say thank you for coming, and bye-bye, everybody.
Thank you for having me. Nice to see you all. Thank you.
If you love this video and would like to see more content like this, then subscribe to my channel.